Hello everyone, my name is Jennifer Paul, and today my partners Katie, Cassette, and myself will be talking to you guys about Charlotte Harris and who she is, what types of disorders she may be a candidate for and why, along with the possible treatment implications that may come with these disorders. We first need to know who Charlotte Harris is. Charlotte Harris was first introduced to us in March of 2010 in the first episode of Victorious. She is the grandmother of Andre, who is one of the main characters in this series. The only other family that is introduced to us besides her grandson in the show is her granddaughter Kendra and Andre's little sister, whose name is not specified. This, however, we can assume would be a third grandchild of Charlotte. So the next question we ask ourselves is, why Charlotte? In the first episode, we learned from her grandson Andre that sometime about 6 years before the first episode, she had supposedly lost her mind. From that time, Charlotte had not left the house in those 6 years up until the time of Andre's showcase in the episode. This is said to be because of her irrational fear of everything. In this next slide, we'll go over some of Charlotte's fears. This list includes people, rabbis, bikinis, breakfast food, vacuum cleaners, refrigerators, the 7-year-old next door, car horns, showers, ceiling fans, clocks, and mirrors. While this is the ones we are introduced to in the show, we are unaware if there are more. Finally, just to finish up getting to know Charlotte a little more, I've given you guys some quotes really just to get an idea of how she was. So the first one is the quote, "I don't know you." This, she was usually screaming at someone in a public setting. It was kind of her go-to for anyone she didn't know or wasn't comfortable with, which was mostly anyone in a public setting. Next is Andre, "It's raining in my bathroom." This is just talking about her taking a shower. Then she ran out to Andre in her bathrobe saying that it was raining. Next is Andre, "There's a helicopter in my kitchen," talking about her ceiling fan. Then Andre, "The numbers on my clock changed again," talking about the time changing on her clock. And then Andre, "There's another me on the mall," talking about her seeing her reflection in the mirror. So next, Katie is going to go over some of the possible diagnoses for Charlotte Harris. Thank you guys.
Okay, moving on to the possible diagnosis that Charlotte Harris could have. The first one on the list is agoraphobia, and agoraphobia is described as an extreme or irrational fear of entering crowded or open spaces, of leaving one's home, or of being in a situation where escape is difficult. And the symptoms for agoraphobia include the fear of anxiety, which must occur in at least 2 out of 5 situations. The situations include public transportation, open spaces, enclosed spaces, standing in line / being in a crowd, or being outside the home alone. And a lot of times with these individuals, they tend to not want to leave their house. A lot of them can't even get past their front porch. The second diagnosis that we have for Charlotte is panic disorder. Panic disorder is described as an anxiety disorder marked by sudden and recurring episodes of great terror, as well as symptoms such as chest pain, heart palpitations, shortness of breath, dizziness, and or abdominal discomfort. Symptoms also include having had at least one panic attack, worries about having more panic attacks, and worrying about what a panic attack means. And an individual experiencing this might ask themselves questions like, am I losing my mind? What is happening? Etc. In addition, symptoms also include a pounding or racing heart, sweating, chills, trembling, breathing problems, weakness or dizziness, tingly or numb hands, chest pain, stomach pain, nausea, and again, an intense worry about when a next panic attack will happen. In terms of Charlotte's qualifications and how she meets the criteria for these disorders, in terms of agoraphobia, Charlotte displays a fear of panic in multiple locations, including open spaces, crowds, and being outside the home alone. You see in the show that she is very panicked and very anxious, very on edge whenever she is outside her home. She tends to be seen in crowded public places throughout the show, where she is clearly displaying emotions of discomfort. In addition, it is mentioned in the show that prior to the first episode, so prior to the series beginning, she had not left her house in 6 years and only left the house to watch her grandson Andre perform in a showcase. In terms of Charlotte's qualifications for the criteria for panic disorder, it kind of goes hand in hand with agoraphobia, but Charlotte does display recurring episodes of fear, whether she is in a enclosed space at home or out in public in crowds, in front of lots of people. She has multiple panic attacks. Every time she is shown in the episode, she is at least showing one type of symptom of a panic attack, and she is constantly worrying about what her panic attacks mean. She mentions in the show constantly asking her grandson Andre, like, what's going on in any type of setting. She is confusing multiple things, panicking about essentially everything, and it is mentioned that she is afraid of virtually everything. In terms of Charlotte's disorder development for agoraphobia, she could have developed her agoraphobia following her panic disorder. It is known that a lot of individuals who do suffer from agoraphobia have had panic disorder or panic attacks in the past, and most individuals, again, who develop agoraphobia do so after experiencing one or more panic episodes, which makes them fearful of having another panic attack and eventually start to avoid areas where it might happen. And people who suffer from agoraphobia typically find it difficult to feel comfortable in public places, especially where large groups assemble, and we have seen that in Charlotte in episodes where she is exposed in public places. And for Charlotte's disorder development and panic disorder, the following factors may increase the chances of experiencing panic attacks and disorder. It could start off with panic attacks or disorder in the family, and unfortunately we don't get to learn too much about her family history or any of her really past life events, so we don't really know exactly what could have triggered her illness, but it is mentioned in the show that she is mentally ill. They just don't really give a lot of background in that aspect. But again, a major life stressor such as a loved one's death or significant sickness could have triggered it, as well as a traumatic event such as a sexual attack or a major automobile accident.
There are several options for Charlotte in terms of treating her panic disorder and agoraphobia diagnoses. She does not have a set treatment plan, but could try out these options. Since her agoraphobia seems to stem from panic disorder, we will need to prioritize treating it first. Charlotte could be put into exposure therapy. Exposure therapy is often believed to be ineffective, but is actually one of the most effective methods of treating anxiety disorders. This method of treatment would train Charlotte's brain to recognize less things in her environment as stressors, such as her shower, mirrors, and many other things. This method might take some time, but would give her significant relief from her panic attacks. Charlotte could also engage in cognitive behavioral therapy, which would also rewire the way she thinks and prevent spiraling. This could also help treat her agoraphobia. In terms of medication, Charlotte could benefit from a combination of both therapy and medication. Medication would include antipsychotics and or antidepressants to help her break away from delusions and could help in her agoraphobia. A lifestyle change that could help Charlotte after treatment could be leaving LA and moving to rural California. There would be less triggers this way without as much going on and would give her more space to herself.